with Insomnia Mom. I'm here today with Dr. Taylor from Rangeline Chiropractic. We are in the Zionsville West Carmel location. They also have another location in Carmel. So Dr. Taylor, tell me a little bit more about what to expect as a first-time patient.
As a first-time patient, you have two options to really book. You can either book online via the website, or you can call and schedule an appointment. With either, you're going to get a scheduled time to talk with one of our doctors to make sure that chiropractic is a great fit for you.
So then tell me what happens when you come in. The initial call is done, and then I come into the office for my first appointment.
Yep. For your first appointment, we're going to go ahead and get started with a biomechanical assessment. So you might have pain in a specific area or region, and I understand that, but I'm going to look at you head to toe from the top and the bottom all the way up. And with that, we're going to do a posture screen, foot scan, check vitals, range of motion, x-rays if necessary, things like that to get a true understanding of what is going on and how we can help you.
Tell me about the range of services you offer here at Rangeline.
Yes, here at Rangeline, we do chiropractic adjustments. We do therapies ranging from cupping, scraping, dry needling, and we also have home corrective equipment, things like custom orthotics, cervical pillows, apex supports, and we do corrective exercises.
So Dr. Taylor, I know a lot of people are hesitant about coming to a chiropractor, especially because they think that there's going to be cracking or popping. How do you answer questions about that?
Yeah, of course. So that popping noise that you hear, or sometimes you might feel that release, all that is just the fluid in the joints moving around. That is supposed to happen when you're applying a force to that area. With it though, it doesn't always have to happen. So that is one technique of chiropractic called full spine or diversify, but there are a range of techniques. So an example of a technique where you wouldn't hear any popping or cracking noise is the activator tool here. So the difference between me using my hands to adjust you or using this tool is it's a lot faster, so it's a lot less force going into the body, so you won't necessarily hear those popping or cracking noises. And it's safe and effective. I use it on newborn babies all the way up until elderly age patients.
So tell me a little bit about the average frequency of a patient who's receiving chiropractic care.
Yeah, so with frequency of care, it depends on what the person is coming in with. If they have something that is new, a new injury that just recently happened, with them, they're going to come in multiple times per week, and then it'll start to space out as they go and their acute injury is healing. With someone who has had a longevity or a chronic irritation, that's going to take more time to fix those correct those imbalances to prevent them from having that continuous lingering. And then we have like wellness care where patients don't really have any major complaints anymore, and they are just coming in to make sure everything's in the proper alignment and their body is working and functioning at its best.